Chronic obstructive pulmonary disease, or COPD, is made up of three related conditions: chronic bronchitis, chronic asthma, and emphysema. In each condition, there is chronic obstruction of the flow of air through the airways and out of the lungs. Estimates reveal that over 20 million people in the U.S. have evidence of impaired lung function, and nearly 13 million have been diagnosed with COPD. This makes COPD an underdiagnosed and undertreated disease. COPD is the fourth leading cause of death and the second leading cause of disability. While asthma features obstruction of the airflow out of the lungs, it is usually reversible and is not classified as COPD because airflow is normal between attacks. However, if asthma is left untreated, the chronic inflammation associated with the disease can turn into COPD. Often patients with COPD are diagnosed differently depending on the symptoms they have at the time of their doctor visit. For example, if they primarily have shortness of breath, they may be diagnosed with emphysema. Conversely, if they mostly have cough and mucus production, they are referred to as having chronic bronchitis.
Individuals with COPD are sometimes thought of as just some of them have chronic or have bronchitis or chronic bronchitis. Some of them may not produce phlegm, as those individuals tend to do, and their major problem may be that of emphysema or tissue destruction. But actually, most patients have some of each, but they can be more on one end of the spectrum than the other.
Another cause of COPD is exposure to indoor or outdoor pollutants. These pollutants include dust, sediment, smoke, and a wide variety of industrial and environmental particulates. 90% of COPD cases are attributed to smoking, and an estimated 15% of all smokers will develop COPD.
It seems like every spring I get this bronchitis, and doctors don't know if it's from dust in the air out west or if it's from dust off the fruit trees. But I get a lot of congestion, and I get short of breath. Can't walk very far, very fast. Can't swim very well.
There is no cure, but it depends at what stage they are. Often just quitting smoking can be very effective, and some of those patients, the disease can stabilize, and then they can go back to the trajectory of aging. We do all lose lung function as we age, as part of the aging process. But of course, individuals who develop COPD, they do this at an accelerated rate.
COPD can also cause you to become less active over time. And with the lungs not functioning optimally to begin with, that can make it even harder for you to breathe. COPD is a progressive condition, but it can be treated with medicine. Ask your doctor if a prescription treatment is right for you. There are two types of inhaler therapy for people with COPD: long-term daily maintenance and rescue medicines. Your doctor may prescribe one or both types, as it depends on your particular health and symptoms. Some patients are on more than one maintenance medicine, and most use rescue inhalers when their symptoms become acute. Antibiotics are prescribed during symptom flare-ups to reduce infection and inflammation, because infections generally make COPD worse. In more extreme cases, oxygen therapy at home may be needed if a person has a low level of oxygen in their blood. Pulmonary rehabilitation does not alone cure lung disease, but it can teach you to breathe in a different way so you can stay active. Exercise programs using this pulmonary rehabilitation are also important to help maintain muscle strength in the legs, so less demand is placed on the lungs when walking. From a prevention standpoint, there are things you can do to make it easier for yourself around the home. These include avoiding hot, humid air or very cold air, making sure no one smokes in your home, maintain your body weight with diet and exercise. Eating a healthy diet with fish, poultry, or lean meat, as well as fruits and vegetables, is an easy step to take. Being overweight can cause undue strain on your heart and lungs, making it harder to breathe. If you are underweight, you may have less energy and your body will be less capable of fighting off infections. Eating healthy foods will help you stay strong. If it is hard to keep your weight up, talk to a doctor or dietitian about what you should be eating. Your COPD can be managed. Enhance your quality of life with the help of your doctor. Set goals with them about certain lifestyle changes you should make. When your body is in better shape, you may be more active without shortness of breath. While COPD can't be cured, it can be treated at any stage. With the right treatment and lifestyle changes, you may improve your breathing today and every day. So talk to your doctor about your symptoms, activity level, and smoking history. They will do a full and thorough workup and may use a simple breathing test called spirometry. Based on all this information, your doctor will tell you if you have COPD and how best to treat it. The goal is to get you in the best physical shape that you are capable of, and then have you be able to maintain that condition on your own. Pulmonary rehabilitation helps you by curbing and reversing some of the effects of COPD. This helps you feel stronger and able to do more with the lung function you've got. One more reason for you to get up, get out of the house, and do things. It's never too late to start.